Hello again, this is Mr. Salazar, and so for this video, I want to go over the difference between the bag mask device, which is this one right here, and the pocket mask. All right. Reasons why I do this when my students take the practical exam, sometimes because of the nerves, they'll use the wrong one. For example, they'll use the bag mask for the one rescuer, or they'll try to use the pocket mask for a two rescuer CPR. And so I kind of want to just go over when to use each one and how to use them. All right. Now, if you've done the CPR training, you've probably realized by now that compressions takes physical effort. All right. And so for me, I feel like breaths are going to be the harder skill. Breaths take technique, all right? If you don't do the proper technique to give breaths, you're not going to see that chest rise, all right? And in order to pass your practical exam for CPR, I have to see the chest rise. So let's talk about the pocket mask first. All right, so again, pocket mask is going to be used for a one rescuer CPR. All right, so each of you guys have received or will receive a mouthpiece, and it goes in just like so. And so the pocket mask is used for a one rescuer CPR when you are by yourself and other healthcare providers have not arrived to the scene yet. All right, take a look at the pocket mask. It's shaped like a pear. So this little small section here goes towards the bridge of the nose. And let me position myself correctly here. So when you're by yourself, you're going to be at the side of the patient. All right, and take a look at my hand placement. All right, so I'm going to place this over the patient's face, and I'm pressing down. All right, the idea is that I don't want any air to come out through here. I want the air to go into the patient's mouth when I give breaths. All right, and now take a look at this. All right, quack quack. All right, with my thumb, I'm also pressing down here just to make sure no air goes through the sides, and I'm going to use this section right here to open the airway. All right, paying very close attention to not touch the soft tissues that are here. If not, I'm going to block that airway. All right, so we're going to go ahead and open the airway, and we're going to give 2 breaths. All right, each breath over 1 second. All right, and just enough to see the chest rise. All right, and so one of the, how do you know that you're giving good breaths? Well, you'll see the chest rise. All right, so definitely keep that in mind. All right, so 1 breath, 2 breaths. All right, and so again, this is going to be for a one rescuer CPR, and it takes technique. All right, so if you, this is definitely one of those skills that I recommend you practice if your instructor gives you time before your practical exam. Like I said, using the pocket mask and the bag mask device, you're not going to get tired from using them like you would doing compressions, but they take technique. All right. The next one is going to be the bag mask device. All right. So the bag mask device is going to be used when you're doing a 2 rescuer or multi-rescuer CPR. All right. So again, this one's for when you're by yourself. This one is when there's other healthcare providers with you. All right. Now, for this one, you want to position yourself at the head of the victim. All right. So how does that look like? It looks just like this. All right. So right over here. And let's think about this, right? So if it's a multi-rescuer CPR, you're going to have another healthcare provider right over here trying to do CPR. You may have another healthcare provider here trying to do the AED, and you may have like a nurse and the doctor administering medications or just being the team leader. So we want to make sure that we stay in our lane and that we are doing this correctly. And the way we do it correctly is by being at the head of the patient. All right. So again, take a look at the mask. All right. It's shaped like a pear. The little part goes to the bridge of the nose. All right. And so for this one, the technique, it's called the EC clamp technique. So you make an E with these fingers, and then you make a C right over here. All right. And so my C holds this portion right here, and it's going to press down. It's going to press down on the patient's face to make sure that no air comes out of the sides over here. All right. And now with my E, I'm going to open that airway. All right. With my other hand, I'm going to provide breaths. And how do I know if I'm giving good breaths? Well, I'll see the chest rise. All right. A little bit of troubleshooting. All right. So people with small hands. All right. I have relatively small hands, and sometimes you have to adjust your technique to be able to get that chest to rise and make sure that no air comes out through the side. So things that I've seen work for some of my students is, do you guys take a look at that C? Instead of putting the C here, I want you guys to pull your elbow out like so. And then that way the C is kind of going in like this, and your E is still pulling on that, pulling up that airway open, and you're able to give that breath. So usually people with small hands, this kind of tends to work. And again, the trick is to bring that elbow out. So instead of right here, you want to bring it out a little bit. All right. If you don't have dexterity of both hands, or again, if you feel like your hands might be too small to grasp this little blue pump right here, things that you can do for that is you want to bring your thigh just a little bit forward, and let me do this, and you want to go ahead and just press it, open the airway, and press it against your thigh. So that could also work. All right. So those are some things that you want to keep in mind. All right, guys. So other things, the pocket mask and the bag mask device, they come in different sizes. So these are the adult sizes, all right? And I have pediatric or infant sizes right over here as well. So this is a bag mask device for an infant. Lot cuter, very cute. And here we have a pocket mask for an infant, right? So a lot smaller. We want to make sure that we're using the correct size, all right? And that is all I have for you guys, all right? Other things where I see students kind of like miss on the practical exam is going to be opening the airway, all right? So if your instructor tells you, or if I tell you when you take my class, you know, open the airway, this is how opening the airway looks like. We're asking you to do this, all right? This is going to open up the airway and allow the air to go into the lungs and will cause that chest to rise. If I don't open the airway, nothing happens, all right? No matter how hard I try. So those are things to keep in mind. How do you practice this skill? So here's my advice to all my students. You want to practice this and get to a point where you can get the lungs to rise on the first try. So you go ahead and place it on the face, open the airway, give 2 breaths, right? Take off the mask, do it again. Place the mask on the face, open the airway, give 2 breaths, take the mask off, all right? Sometimes I see students, you know, do this, all right? And that's not really showing you or training you to have proper technique. If you train yourself to take the mask off, put it on, open the airway, and give 2 breaths, it's going to train your muscles to use the proper technique every single time, all right? And again, this is going to be used for a 2 rescuer CPR. All right, guys, that is it. Thank you so much for listening. And please watch the other videos that I will be posting into your Canvas course. Thank you.